So yesterday at the hospital, I had the unique and exciting opportunity to assist in repairing what's called a vesico-vaginal fistula. And for those that don't know, allow me to explain. A vesico-vaginal fistula is basically an abnormal opening that occurs between the walls of the vagina and the walls of the bladder. In more extreme cases, a fistula can occur between the walls of the rectum and the walls of the vagina. In both cases, urine can leak into the vagina and feces can also leak into the vagina. It's a devastating condition to say the least. What many people don't know is how the technique developed to repair vesico-vaginal fistulas. And the technique was really made famous by Dr. Marion J. Sims, who in the mid 1850s perfected his technique in repairing vesico-vaginal fistulas by experimenting on his enslaved Black women who he had held captive. He would experiment on his Black female enslaved persons without the use of anesthesia and without the administration of antiseptics. Despite during that time, ether was widely used as a potent anesthetic agent. Even in Dr. Marion J. Sims' memoirs, he said himself, just like many other bigoted people during that time and even today still believe, that Black people feel pain less than non-Black people, which really justified their brutality and inhumanity in experimenting on these enslaved persons without the use of anesthesia and without the use of antiseptics. It goes even further that Dr. Marion J. Sims insidiously would intentionally get these enslaved women addicted to morphine, not by administering morphine before surgery, but only administering the morphine after surgery, which would allow them to be more compliant in coming back for repeated surgical experimentations because the addicted person would be able to get the drug after the surgery. Now, even today in 2025, there is a surgical tool that is called a Sims speculum. And a speculum is essentially a tool that we use in surgery that we insert, in this case, in the vagina to create more of an opening to retract tissue so we can have better view of what we're trying to repair. And this tool, this Sims speculum, is named after Marion J. Sims. And it's really baffling and really horrifying because when Dr. Marion J. Sims was experimenting on his enslaved women, and these male white doctors or fellows were basically used to hold down these enslaved women. And within a year, all of these fellows, male doctors, had left because they could no longer tolerate the horrific shrieks and pain to which they experienced while working with Dr. Marion J. Sims. One of these fellows is Dr. Bozeman, who actually went off and developed his own techniques in repairing vesico-vaginal fistulas. And a surgical forceps is named after him as well, called the Bozeman forceps. And to bring this all together, as a Black male health professional working in the operating room, it's really a profound experience for me to know what I know about the unjust medical experimentation on Black people in colonial times, but also throughout the present, even in the 20th century and the 21st century, to have a hand in actually helping my physicians and my surgical team to help to give relief to patients. But at the same time, I feel compelled to really speak out against the historic injustices that Black people have faced for the sake of modern medicine. I haven't even really mentioned Henrietta Lacks. We're really just talking about Marion J. Sims, but that's just how massive this type of really history is and how important that this history is to be told. If you haven't read the book by Harriet Washington, I highly recommend this book. This book was highly influential for me in pursuing my career as a healthcare professional. And even if you're not trying to pursue a career in healthcare, I think it's extremely important for not only Black people to know this, but also white people, Indian people, Asian people, Latino people. All people should know this history because the more informed you are, the better you're able to understand the dynamics of the white supremacist infrastructure that we all live in today. And it's still sad because many people feel that white supremacy is a fallacy, but just to know that a surgical instrument that is used today is named after this man who experimented inhumanely on Black Americans, we would not fathom that a tool that was used to put Jews into gas chambers was actually still being called to the same use today. No one would ever really consider that type of thing. But because it's Black people, it was experimented on Black people, it's okay. And I feel like it's in my position to be able to explain this and speak about this so I can be a part of that change.